Debrief checklist. Research has shown that teams who actively debrief their own performance can improve their teamwork in real time. Debriefs include accurate recounting and documentation of key events, analysis of why the event occurred, what worked, and what did not work. Discussion of lessons learned and how the team can alter the plan for the next time. Reinforcement of what went well and how the team can repeat the behavior and plan the next time, and establishment of a method to formally change the existing plan to incorporate lessons learned. Debriefs are most effective when conducted in an environment where honest mistakes are viewed as learning opportunities. Debriefs can be brief, about 3 minutes or less, at team event, typically initiated and facilitated by the team leader. This checklist can be used by the team during a debriefing to ensure that all information is discussed. Here are 2 guidelines and conducting debriefs. Facilitate the discussion as a leader by asking questions related to team performance. For example, questions might include, what do I do well? What did not go well when we can improve? Recap the situation, background, and the key events that occurred. Similar to the brief, the team leader should cover the items on this or a similar debrief checklist. This checklist can be used by the team during a debriefing to ensure that all information is discussed. The team leader should then summarize lessons learned and set goals for improvement. These leadership techniques also help in maintaining an awareness of what is happening in your unit and with your team members. Situation monitoring is a continuous process that all team members should participate in. Situation monitoring is a continuous process because of a dynamic situation in which teams function. This process consists of 3 components. Situation monitoring, an individual skill, is the process of actively scanning and assessing elements of the situation to gain information or maintain an accurate understanding of the situation in which the team functions. Situation monitoring is a skill which implies that it can be trained, developed, and improved. It enables team members to identify potential issues or minor deviations earlier enough so that they can correct and handle them before they become a problem or cause harm to the patient. Situation awareness, an individual outcome, is a state of knowing the conditions that affect one's work. It is a detailed picture of the situation, not that. Situation awareness is not a static thing or concept because the situation and the context in which the situation exists are dynamic and ever-changing. Team members must continually assess relevant components of the situation and update their individual situation awareness. Share mental models. A team outcome are the result of the each team member maintaining his and her situation awareness and sharing relevant facts with the entire team. Doing so helps ensure that everyone on the team is on the same page. Step. How do you acquire a trained eye as you monitoring the situation on your unit? What are relevant components of the situation that provide clues about impending complication or contingencies? The step process is a mnemonic tool that can help you monitor the situation and the overall environment. The step process involves ongoing monitoring of the status of the patient, team members, environment process toward the goal. It is not only the responsibility of the direct care team to monitor these elements. Anyone involved in the care of patients or the environment should be expected to monitor the situation. Examples, respiratory therapies are not led. The ventilated patient is showing a marked increase in respiratory rate and might indicate an increased level of pain that cannot be communicated status. The patient's nurse is busy helping another patient team members. It is a shift change and everyone is busy. So you check the medication record and know that the patient is overdue for the morbid environment. You notify the oncoming nurse of your concern. Progress. Step assessment. In a healthcare setting, the most obvious element of the situation requiring constant monitoring is your patient status. Even minor changes in patient vital signs may require dramatic changes in the team's actions and the agency of its response. When assessing patient status, consider patient history, vital signs, medications, physical exam, plan of care, and psychosocial condition. For example, patient's stress level. You should also be aware of team members' status, including fatigue level, workload, task performance, skill level, and stress level. You should be aware of environment, including facility information, administrative information, human resources, triage accuracy, and equipment. And finally, you should assess your process toward goals by asking key questions. These questions are, what is the status of the team's patients? Has the team established the goals? Has the team accomplished their tasks or actions? Is the plan still appropriate? Cross-monitoring. Healthcare providers are just as prone to human error as a general population. Teams that recognize and maintain an awareness of their individual team members' functioning more likely to provide constructive feedback, have a shared understanding of the situation, and lend support or assistance when needed. Observing the actions of fellow team members of cross-monitoring is a safety mechanism that can be used to mitigate error before the patient is harmed. Commonly, referred to as watching each other's back, monitoring other team members by keeping track of their behavior and providing feedback ensures that procedures are being followed appropriately. It allows team members to self-correct their actions if necessary. Staff members need to constantly be aware of the situation, anticipate next steps, watch each other's back, and take appropriate corrective action to prevent errors from reaching the patient. Let's try an exercise to demonstrate cross-monitoring. Find a partner. So you are each in a pair with your partner. Share an example of a situation in which cross-monitoring was successful and one in which cross-monitoring should have been used but was not. I'm safe checklist. Awareness of your own condition to ensure that you are fit and are ready to fulfill your duties is essential to delivery safe quality care. Team members should assess and report if there is a personal situation affecting their ability to perform. MSAFE is a simple checklist that can be used to determine both your coworkers and your own ability to perform safely. MSAFE stands for illness. Am I feeling so bad that I cannot perform my duties? Medication is a medication I'm taking affecting my ability to maintain situation awareness and perform my duties. Stress is there something such as a life event or situation at work that's distracting from my ability to focus and perform my duties. Alcohol drugs is my use of alcohol or illicit drugs affecting me so that I cannot focus on the performance of my duties. Fatigue, the effects of fatigue, it should not be ignored. Team members should alert the team regarding their state of fatigue. For example, saying, watch me a little closer today. I only had 3 hours of sleep last night. Eating and elimination. Has it been 6 hours since I have eaten or used the restroom? Many times we are so focused on ensuring our patients' basic needs that we forgot to take care of our own. Not taking care of our elimination needs affects our ability to concentrate and stresses us physiologic. Teams should be encouraged to set goals concerning items on this checklist. For example, setting a goal that everyone will be given the opportunity to take a break and have lunch today. Task assistance, mutual support, which is commonly referred to as backup behavior, is critical to team performance. Mutual support is derived from situation monitoring through the ability to anticipate patient needs as well as other team members' needs with accurate knowledge of their responsibility. One method of providing mutual support is through task assistance. This includes both asking for assistance when needed and offering assistance to team members when opportunity arises. Task assistance may involve asking for assistance when overwhelmed or unsure, helping team members to perform their tasks, shifting workload by redistributing tasks to other team members, delaying or rerouting work so the overburdened member can recover, and filling in for overburdened team members when necessary. Task assistance is guided by situation monitoring because situation awareness allows team members to effectively identify when they or other team members need assistance. To a certain degree, some of us have been conditioned to avoid asking for help because of the fear of suggesting a lack of knowledge or competence. Many people refuse to seek assistance when overwhelmed by tasks. In support of patient safety, however, task assistance is expected. Feedback. Another strategy to foster mutual support is feedback. Feedback is information provided for the purpose of improving team performance. The ability to communicate self-improvement information in a useful way is an important skill in the team improvement process. Feedback can be given by any team member at any time. It is not limited to leadership roles or formal evaluation mechanisms. Effective feedback benefits the team in several ways, include fostering improvement in work performance, meeting the team's and individuals' need for growth, promoting better working relationships, and helping the team set goals for ongoing improvement. And focusing and assertion. A third strategy used to facilitate mutual support is advocacy and assertion. The focusing and assertion intervention are invoked when a team member's viewpoint does not coincide with that of a decision maker. In advocating for the patient and asserting a correct action, the team member has an opportunity to correct errors or the loss of situation awareness. Failure to use advocacy and assertion has been frequently identified as a primary contributor to the clinical errors found in malpractice cases and sentinel events. You should advocate for the patient even when your viewpoint is unpopular, is in opposition of another person's views or questions authority. When advocating, assert your viewpoint in a firm and respectful manner. You should also be persistent and persuasive, providing evidence of data for your concerns. Two challenge rule. One strategy to facilitate team members speaking up is the two challenge rule. It is important to voice your concern by advocating and asserting your statement at least twice. If the initial assertion is ignored, that's the name two challenge rule. These two attempts may come from the same person or two different team members. The first challenge should be in the form of a question. The second challenge should provide some support for your concern. Remember, this is about advocating for the patient. The two challenge rule ensures that an expressed concern has been heard, understood, and acknowledged. There may be times when an initial assertion is ignored. If after 2 attempts the concern is still disregarded, but the member believes patient and staff safety is more or maybe severe compromised. The two challenge rule mandates taking a strong course of action and using a supervisor or chain of command. This overcomes our natural tendency to believe that team leader must always know what he and she is doing, even when the actions taken depart from established guidelines. When invoking this rule and moving up the chain, it is essential to communicate to the entire medical team that additional input has been solicited. If you personally are challenged by a team member, it is your responsibility to acknowledge the concerns instead of ignoring the person. Any team member should be empowered to stop the lie if he or she senses or discovers an essential safety breach. This is an action that should never be taken lightly, but requires immediate cessation of process to resolve the safety issue. CUS, CUS. Using the CUS technique provides another tool for conflict resolution. Advocacy and mutual support signal words such as danger, warning, and caution are common in the medical arena. They catch the reader's attention in verbal communication, cause CUS, and other signal phrases have a similar effect. If all team members have a shared mental model and are on the same page, when these words are spoken, all team members will clearly understand the issue and its magnitude. To use pause CUS, first state your concern, then state why you are uncomfortable. If the conflict is not resolved, state that there is a safety issue, discuss in what way the concern is related to safety. If the safety issue is not acknowledged, the supervisor should be notified. A few other phrases in use are, I would like some clarity about, would you like some assistance? Conflict resolution task script. Conflict can occur in teams, and it is important to know how to handle such situations when they occur. The two challenge rule, which we have already discussed as a tool to advocate and assert for patients, can also be used as a conflict resolution strategy. When team members have different information, the two challenge rule can be used to bring up the different information so it can be addressed. The DESC task script can be used to communicate effectively during all types of conflict, and is most effective in resolving personal conflict. The DESC script is used in the more conflicting scenarios in which behaviors are not practiced, hostile and harassing behaviors are ongoing, and self-patient care is suffering. DESC SC is a mnemonic for D, describe a specific situation. E, express your concerns about the action. S, suggest other alternatives. C, consequences should be stated. Ultimately, consensus should be reached. There are some crucial things to consider when using a DSC script. Time the discussion work on win-win, despite you are in the personal conflict with the other party. Team unity and quality of care depending on coming to a solution that all parties can live with. Frame problems in terms of personal experiences and lessons learned. Choose the location. A private location that is not in front of the patient or other team members will allow both parties to focus on resolving the conflict rather than on saving faces. Use I statements rather than blaming statements. Critic is not criticized. Focus on what is right, not who is right. In reviews, several key concepts and tools or techniques can be used to work as an effective team and ensure patient safety. The team performance evaluation to prevent types of behaviors that you might observe in a team's performance. Team structure assembles a team, assigns or identifies team members' roles and responsibilities, holding team members accountable. Includes patients and families are part of a team. Communication provides brief, clear, specific, and timely information to team members. Seeks information from all available sources. Use checkback to verify information that is communicated. Use SBAR, call-out, and hang-off techniques to communicate effectively with team members. Leadership. Identify team goals and visions. Use resources effectively to maximize team performance. Balances workload with the team. Delegate tasks or assignments appropriate. Conduct briefs, huddles, and debriefs. Role models teamwork behavior. Situation monitoring monitors the patient status, monitors fellow team members to ensure safety and prevent errors, monitors the environment for safety and availability of resources, for example, equipment, monitors process toward the goal and identifies changes that could alter the care plan. Fosters communication to ensure team members have a shared mental model. Mutual support provides task-related support and assistance. Provides timely and constructive feedback to team members. Effectively advocates for patient safety assertive statement to challenge rule or CUS course. Uses to challenge rule CUS and tasks scribe to resolve conflict. The team performance evaluation tool is generic, meaning it is not designed to focus on any particular clinical unit. However, it can be summarized as needed. Some ways the tool might be integrated into practice include as a means for providing feedback and coaching to staff. As a checklist for reviewing some expected team behaviors in staff of team members, and as a formal evaluation tool to evaluate the patient's performance on the listed behavior. Tools and strategy summary. Throughout this course, you have received information about barriers to team activities, tools and strategies to overcome such barriers and the outcomes of effective teams. You have learned communication skills such as spar, hang off, and call out. You have also learned about leadership strategies for managing resources, along with tools for facilitating team events, such as briefs, huddles, and debriefs. You have also learned the situation monitoring, the manic step, and the mutual support tools, such as two challenge rules, CUS-DSC script. Remember that enhanced patient safety is the ultimate outcome of consistently using the TeamSTEPPS tools and strategies to overcome barriers to team effectiveness. To review what we have learned across the module, you will watch a video scenario of a team in action. As you watch the video, make note of the use of TeamSTEPPS tools and strategies that are used. The most important thing to take away from this course is how you will apply the core and the strategies that you learn in your daily work.
Hey, Liza. Mrs. Peters still seems a bit groggy. I'm running up the floor to see our discharges. I'll be back in about 15 minutes. And she did well. She should be able to go home by Friday. I want to keep an eye on her calcium. Will she be going to the floor soon?
Yes, I'm about to start report.
Great. If you need me, just page me.
Okay. Hi, Carla. This is Liza down in the recovery room. I'm calling about Dr. Daniel's patient, Miss Angie Peters. She is stable and ready to come up to the floor. She just had a big goiter removed, and she's 54 years old. No major medical problems except for hypertension. Vitals are stable. Pain score is 2 out of 10. She has no drug allergies. Dr. Daniels, the attending, wants to keep an eye on her calcium. You know, she might be a teacher or something like that. Anyway, do you know which bed she's going to? She should be ready to go in about a half hour.
Well, your vital signs look good. Now, Angie, are your fingers feeling numb or tingling? Are you feeling any shortness of breath, any muscle cramps?
No, I think everything's feeling fine.
Good. Now, here's your call button. I want you to use this if you experience any numbness or tingling in your fingers, any shortness of breath, or any muscle cramps.
I will.
Okay, now you get some rest, okay? Calcium level Q, 12 hours. Huh. That's a little weird. She crossed out the residence order. I wonder why. Oh, well. Billy, we need to get these orders in so the blood draw gets added to the afternoon run.
Okay.
My fingers feel all numb. It's my dark arthritis getting me all cramped.
Mom, shouldn't the pain medicine be treating that? Do you want me to call the nurse?
It's not that bad. Anyway, I'm here from my neck, not from my
Well, if you're sure.
I'll be fine. And you need to get on home. just give a big kiss to my little angel from Grandma.
Okay, Mom. You get some rest. I'll be back in the morning.
Okay.
Here's the call button. You make sure you wait for help if you need to go to the bathroom. The last thing we need is for you to fall. I'm Linda Reese. What's going on with my mother, Angie Peters?
Linda, your mom's having seizures. The doctors are getting her stabilized. They're going to have to insert a breathing tube, and she's going to be moved up to the ICU. We've called Dr. Daniels, and she's on her way up.
Did this happen? She was fine
I
when I
know.
left her last night. Why didn't someone call me?
It just happened. Let's go to the waiting room.
Thank you. Wish you have good time. See you next time.